This is a continuation on my interpretation of the health care bill. Now, granted, what we're trying to do here is define vocabulary for you, show you what these things really are, so you can make an informed decision about what you just got. And I can tell you, with 2,000 pages, it's going to take you a while to figure out what you just got and, you know, the whole 9 yards. But anyway, we were talking the last time about how health insurance cannot rescind. Remember, I was talking about rescissions, and I know you've never heard that word before, but now that you had my previous video, you now know what a rescission is. And if you don't, go back to my previous video and you'll find out. The health insurance cannot just automatically rescind your health care coverage for just any reason whatsoever. They can't do that anymore. That's in the bill. But they can do it for fraud or misrepresentation. Now, what is a misrepresentation? In this particular case, and I know that there's a lot of adults that do know what the word misrepresentation is, but teenagers do not, and they may have to do a term paper on something like this, and they don't know necessarily what the word misrepresentation is, so they're trying to flip through a dictionary. Save your dictionary time. I've done it for you. Misrepresentation works something like this. Hypothetical situation. You have a car wreck, and say the only thing got damaged on your car was the front bumper. It wasn't like the engine block got destroyed or your radiator was busted or anything like that. Just a little dent on the front bumper. But then you go on later on and you tell the insurance company that the whole front end of your car has been completely crushed, and you have no more engine, and you have no more radiator, and you have no more this, and you know more. That's a misrepresentation of what happened in the accident, or collision in this case. All right. That's why you have collision insurance. It's not accident insurance anymore. It's collision insurance, because not all collisions are accidents. I can tell you that right now. But anyway, that's what it means by misrepresentation. You're saying that something is actually worse than what it originally was. Okay, and that's a misrepresentation. And if the insurance company finds out about it, they can cancel your policy. Then you're up the creek without a paddle. Alright, and then they have you referring to sections 2702C and 2742B. And I'll say that again. Sections 2702C and 2742B. Now, these are sections in the new health care bill, and we haven't gotten there yet. Oh boy, it's going to be a while before we get there. But you're supposed to refer to both of these little sections to find out what it exactly means healthcare wise when you talk about misrepresentation or fraud. Okay? And then the healthcare bill goes on to talk about the United States Preventive Services Task Force. What is the United States Preventive Services Task Force? Well, they're a panel of experts. Okay? And what they're trying to do, these panel of experts would normally be providing primary care or prevention. Okay? So these would be your general practitioners, the first doctor you would see if you're going to make an appointment to go to the doctor's office, that kind of thing. All right. And these kind of doctors, they offer you primary care. They're the ones that, well, if you have a common cold, they'll prescribe you a little medicine, or if you have a flu, they'll prescribe you a medicine or whatever. They're not your surgeons. They're not the people who work in the ER, that kind of thing. Okay, that's why they call them primary care physicians. They're the first doctors you see before you go off to see some kind of specialist. Now, there's another word called systematically. Systematically means regularly or methodically. That means it's a routine. It's just like when you brush your teeth. You systematically brush your teeth every day, so on and so forth. Same type of deal. These people do things in a systematic way. Alright, now what they're doing systematically is they are studying the evidence of effectiveness. Now what that means is they're seeing how effective their primary care treatments are on their patients. Okay? That's what they call evidence of effectiveness. They're studying this evidence of effectiveness, And then, through what they learn from the evidence of effectiveness, they take the evidence of effectiveness, they study it, and through that, they start making recommendations for clinical preventive services. Now, these clinical preventive services are services that doctors routinely give to you. Now, these would be the kind of things where a doctor would say, okay, I want you to lose a certain amount of weight because if you don't, you're going to develop X and Y diseases, probably diabetes in that case, so on and so forth. That they come up with guidelines to give to doctors, to give to you, to keep you from getting certain diseases. All right. In other words, a doctor would say to you, well, go get so-and-so shot, and when you do, you'll prevent yourself from getting the H1N1 vaccine, the H1N1 flu, so on and so forth. I think you get the picture here. All right. Now, there's another word called epidemiologist. What is an epidemiologist? Well, these people are the people who study the cause and prevention of diseases in a population. Okay? What they're studying is they're studying what causes particular diseases to spread through a population, and then they're also studying ways to prevent those diseases from spreading through that same population. All right. Now, the United States Preventive Services Task Force is funded by the United States Department of Health and Human Services. And I'm sure you've heard of that one before, so I won't go into an in-depth discussion of the Health and Human Services Department of the United States. You can look that up for yourself. Then there is an advisory committee on immunization practices. And it advises the Centers for Disease Control and Prevention. All right, now this advisory committee is comprised of 15 experts who know all about immunizations, okay? And what they do is they provide guidance to the CDC, the Centers for Disease Control. That's what CDC stands for, Centers for Disease Control. And they provide guidance to these people on how to develop vaccines and how to distribute the vaccines, so on and so forth, so that the CDC can make those decisions and then therefore distribute vaccines and create them for the population. And I think you're kind of getting an idea about this. Anyway, these two organizations are listed in the health care bill, and if you didn't know who these people were, you wouldn't know what they were doing and why they're part of this new health care bill. Hopefully my explanations have given you a little more insight onto what's going on in the health care bill. I will tell you more in a future video, so stay tuned.